brought to you by Malaysia Healthcare Travel Council in Bangladesh in association with GD Assists. Hello everyone, welcome to Radio Shadhin 92.4 FM. Here is your host Ahona Tasnim Khan, and I am here with another episode of Be Healthy with a very special guest with me. Treatments are something that is needed on our everyday life to everybody, and treatments is a basic need of our life. We are always worried about where to get the effective, efficient and affordable treatment. Of course, we are having some good news, and I want to introduce you with my very, very, very special guest. But I want to tell you, we are on the show Be Healthy, brought to you by Malaysia Healthcare Travel Council in Bangladesh in association with GD Assist. And yes, let me introduce you with my guest finally, Dr. Mohamed Ali bin Abdul Khader, nuclear medicine and PET CT scan specialist, Mahkota Medical Center, Melaka, Malaysia. Hello, welcome to the show.
Thank you very much.
How are you feeling in Bangladesh?
Oh, Alhamdulillah. I feel very good, very exciting. Nice traffic jam.
Okay.
Nice food. Okay.
Very kind of you to say that.
Right. My name is Mohamed Ali, as mentioned. I'm very glad to be here. This is my second trip to Dhaka, Bangladesh, and I'm here to help disseminate my expertise to you people out there, you listeners from Dhaka and Bangladesh.
Okay, so we want to know, as you are from the side of nuclear medicine and PET CT scan, so I want to know if you can share us about what is PET CT.
Right. Thank you very much. Right, PET CT, it stands for positron emission tomography. It is a very specialized technology which incorporates two high range modality. That is the CT scan, which will tell you the structure in the body, and PET scan, which will tell you the ongoing functional aspect of the lesion in the body. So when we combine the two, that is the PET CT, we get the best of two technology. We see the structure and we see the ongoing cancer process or ongoing disease process. So the important part here is the ongoing cancer process. It tells you whether your cancer is actually functioning or growing at that specific time. Ongoing cancer process.
Okay, so there are so many people who are worried about cancer. We sometimes have a sick patient in our home, our family members who are suffering from cancer. So PET-CT, that is something that you want to know, and please join us throughout the show. You are listening to us at Radio Shadhin 92.4 FM on the radio. You are listening to us through the app, and you are seeing us live from our Facebook page, officially verified Facebook page of Radio Shadhin 92.4 FM. And there is another question that I have for you. Is it the future or the state of the art to detect the diseases in the body? And if so, can it detect all the diseases in the body or only certain type of diseases?
Yes. This PET CT technology has been in the world in the early 70s. But it is only now when the technology has become advanced and the technology has become cheaper, we are getting more and more centers having this PET CT scanner.
Yes.
It is definitely the state-of-the-art technology, and all centers which provide cancer management or cancer therapy should have this PET CT scanner, because it goes hand in hand in the management of cancer patient. Now, the reason why I say this is this machine, this technology will tell you where is the ongoing cancer process, number one, and that's the diagnosis. Number two, it will tell you which part of the body it has spread to, whether it's confined to one area or it has spread to certain part of the body. And that we term as grading.
Yes.
And then with this uptake in the radiation, we can actually measure how much activity is from the cancer cell. That means we can measure the aggressiveness of the cancer. And number four is, after that, all the information given will be given to the referring doctor, that's the oncologist or the surgeon or whoever refer for treatment. And after treatment, we will do the PET CT scan again to look at the effectiveness of the treatment, whether it is still the presence of ongoing cancer process is still there, or it has been effectively treated by the medication. And lastly, the number 5 is, after treatment, cancer being cancer, they can come again, and we want to know whether there is recurrence of the cancer process 12 months down the line or 1 year down the line.
Okay. There, I have a personal question that I want to know. That is PET-CT. Can any person who is suspicious of their health that I might have cancer or I am seeing some symptoms that might lead me to cancer, they can do the procedure as well?
Yes, of course. But this procedure, we most center we do not take in walk-in patient. That means you cannot simply come and say I want a PET CT scan. Our center is all by referral from specialists. That means you can go to your specialist first. If you are worried, your specialist will do a basic test to see or to suspect whether you have cancer or not. Only then they will refer to us, and I will look at the request form and see whether it is indicated or not indicated to do the scan. Yeah,
Okay.
so it's very well protected. We don't do like any Tom, Dick, Harry. It has to be referred.
That's very comforting to know.
Yes.
What are the principles behind the scanning method?
Oh yes, I will give you a very simple explanation of the principle. As you know, cancer cell, I don't know whether you are aware what is the definition of cancer. Cancer means the multiplication of cells. Abnormal multiplication of cells, that means the cell multiply very fast, that's why you see a growth. So that is cancer, right? For the cell to multiply, the cell will require energy. And as you know from your school days, if you are tired, what do? You drink glucose water or sugar water to revitalize.
Yes.
Same thing. If I have glucose and I introduce into the body, more of the glucose will go to the cancer cell, but some of the glucose will still go to the normal cell, because normal cells also need to multiply, but they multiply normally. Cancer cells multiply more. But there is no technology that I can detect the movement of glucose in the body once I introduce into the body. So what I do is I have this glucose, I tag the glucose with the radioactive material. So this is called radioactive glucose. There is fluorine 18, the radioactive part, and FDG is the glucose molecule. So it's called fluorine 18 FDG. That is the radioactive glucose. So based on the same principle, if I introduce this radioactive glucose, more of the radioactive glucose will go to the cancer cell and some will still go to the normal cell. So what happened is, when the beauty of it is when the radioactive glucose goes to the cancer cell, they cannot come out. It's locked inside the cancer cell. So but the radiation can be coming out from the body. All right. So the machine is actually detecting the radiation from the cancer cell, and this radiation that has been detected is converted into colored images, and from there we can actually look whether how big is the cancer, where is the cancer, whether it has spread anywhere in the body. We normally do the scan from the head to the toe, and whether how aggressive is the cancer. Then with that information, I will do my reporting and send it to the referring doctor. Then the referring doctor will treat the patient, and he will send again for a PET scan to see whether the treatment is successful or not successful.
Okay, that's a very that sounded complicated, but I hope you understood it, because cancer is a complicated disease and you have to go through the proper procedure, and that's what doctor was telling us. What are the roles of the PET-CT scan for the cancer management? We want to know that.
Okay, I briefly described it, but now I want to describe in detail. Okay,
Yes,
so when
please.
a doctor requests for a PET scan, what the machine could do and what I can tell them is I can diagnose the lesion. So diagnosis, I can tell where the lesion is. That's the diagnosis. Okay. Then after that, I can measure what is the size of the lesion, and also whether the lesion has spread from the original area to other area or not. That is called grading. As you know, cancer has grade 1, grade 2, grade 3 and grade 4. So depending on where the primary lesion is and whether it has spread to other areas, and that is called grading. Because the grading, the management will depend on the grading that I report. Okay, so we have diagnosis, we have grading, and now we want to detect how aggressive is the tumor, whether the tumor is very, very aggressive, and because this aggressiveness will need different type of medication, right? So that will all be done by the referring doctor once they get my report. So that we have diagnosis, we have grading, we have aggressiveness, and then after treatment, we will do the PET scan again to see how responsive is the treatment, whether the treatment is effective or not. So in treatment of cancer, we have chemotherapy, we have radiotherapy, we have hormonal therapy, and we have other therapy as well, gene therapy and so on. But all this therapy is good, but only PET CT scan will tell you whether the therapy is effective or not. Because after that, when we scan, whether we can see whether there is any more ongoing cancer process. So that will tell you the effectiveness of the therapy. And again, as I tell you, cancer being cancer, once it's been treated, they might come back again.
Yes.
So we want to allay the fear of the people, and the doctor will refer again for a PET scan maybe 6 months down the line or 1 year down the line, depending on the condition of the cancer initially treated, and we want to look for recurrence. And with recurrence, early detection of recurrence means it's much easier to treat the recurrence than when we detect it later.
Okay. Are there any short-term or long-term side effects of this procedure?
Okay. So whenever we use radiation, be it in radiology, X-ray and so on, or in cardiology where we do angiogram or PET CT scan, nuclear medicine, the use of radiation is always associated with some risk, minimal risk in medicine. But the information that we get, that means we must always get the result must always, the benefit must always outweigh the risk. Okay, so the result will always help the doctor to manage the patient properly. So it is the benefit must always outweigh the risk. And it also, when the request come to me, I filter all the cases. Every single case, I will filter to see whether the request is indicated or not indicated. If it's not indicated, I will politely call my colleague and say, this patient is not indicated, this request not indicated, maybe we can do some other investigate like ultrasound and so on. Okay, and the other thing is, all our staff are trained. Fully, we have got the team consists of me as a specialist. We have a qualified physicist to look at the radiation safety of it. We have the pharmacist to measure the exact dose for the patient, and we have the technologists to make sure that images are very nice for me to report. So all of them are by Malaysian regulation, by law. They have to be trained properly before they can perform their duties. Okay, and in the laws in Malaysia, we have two set of laws. One is the training part, and the other one is the radiation safety part. All the facilities there, they are all line, and nobody is to come to in our setup during the investigation. And that's not the other one. The other thing is, we don't do this PET scan on any patient who are pregnant. All right, that's number one, because the radiation might go to the radioactive glucose might go through the placenta and affect the fetus. That's number one.
Okay.
Number two is we don't do the PET scan for any patient who are breastfeeding. But some patients, they insist to breastfeed. So if they want to breastfeed the child, we ask them to express their milk in a container and then put in the fridge, and then after 20 hours, then there's no more radiation from the body, then they can give the milk, and after that they can breastfeed normally. So if you do radioactive glucose, it's 20 hours of abstain from breastfeeding. Thank you.
There are some patient who is taking a therapy, chemotherapy or radiotherapy. Do they need to stay away from children too?
Okay. See, what happened is they are radioactive. Once they've taken the thing, they are radioactive. So we always advise them to stay away from small children, maybe below the age of 5. They stay away just for that 24 hours. All right.
Okay.
And then if they are at home, they drink plenty of water so that they can pass urine as often as they can, because while passing a lot of urine, most of the radiation that do not go to the body will be passed out in the urine and will be discarded. So the more you drink, the more you pass your urine, the more less radiation in the body.
Okay, that's nice to know. Should there be any follow-up scan, or if there is, how often the repeat scan should be?
All right. See, like I told you, follow-up scan is indicated because the doctor might want to know whether his or her treatment is effective.
Yes.
For example, I don't know whether you are aware of this condition called lymphoma. It's one of the commonest cancer in the body. Now, lymphoma will require 6 courses of chemotherapy. All right. In the old days, without the PET CT scan, they will do the CT scans after the 6th cycle. and then they will see a lesion, but it's not really fully know whether the treatment is successful or not. But with PET CT scan, after the third cycle, we'll do a PET CT scan, and if the treatment is effective, you don't see any more activity, then the doctor will continue treating until the sixth cycle. If the PET CT scan shows there's no improvement, it's still very, very aggressive, then he or she might change the regime to another course of treatment. So by changing the course of treatment, we will decrease the amount of side effect on because of the chemotherapy, decrease the cost, because no point treating the patient when it is not effective. So it's very costly. So in that aspect, it is very useful. And the other thing is, you might want to ask whether it's very costly or not. Yes, the initial cost is very costly, but as I say, when you are able to tell whether the treatment is successful or not, and whether you can change the treatment, it's safe on the cost of further further cost of the chemotherapy that is not useful. So they only use the chemotherapy that is useful. Then number one. Number two, that's very, very important, is the psychological impact on the patient. All patients will want to know whether their treatment is successful or not. So with this PET CT scan, I will be able to tell the doctor, or because we can show them in pictures, whether the cancer is still active or not active. So that psychological impact is very, very important for the patient, and then it will alleviate the fear and so on. Right.
Okay. Is the PET CT cost effective? You wanted to, you already briefed that,
Yes,
and
I touched upon that, yes.
I wanted to ask you another thing. That is, there are so many countries that do this kind of treatments, and I have had another Be Healthy episodes, and I came across with many more Malaysian doctors, and they told me Malaysia is cost effective and Malaysia is more affordable than the other countries. Do you agree with that?
Yes, affordable in a way, because if you compare dollar by dollar, US dollar, our rate is much, much cheaper. But what is more important is Malaysia is a Muslim country, and Bangladeshi will feel very, very comfortable to come to Malaysia. The food is about the same. We have many, many mosques and other places of worship. And of course, when you come to Malacca, we have different scenic tourist attraction compared to other part of Malaysia. I think that one, the Malaysian tourism will help to help to explain. But
Yes.
if you come onto my side, you will not regret it. I promise you that.
Okay, that's very nice to know. And there are so many people who has joined our live. We want to take one or two
Of
questions.
course, I'm very happy to.
Okay, Hussein Shahriar is telling, most welcome again Radio Shadhin for bringing the Malaysian doctor to us. We don't get a lot of Malaysian doctors with us, of course, and it's very lovely to have you. Abdul Karim told us, good topic, how much money do we have to pay for this scan?
Oh, okay. In Mahkota Hospital, we have 2 level or 3 level of charges. Okay, sometimes there is a package deal. Like for example, if there's a package for lymphoma, we say like you have to do twice, then the rate is much lower. If you have only a single, then it will be slightly higher. But all in all, it's definitely cheaper than when you go to our neighbor, south neighbor, or the northern neighbor. I won't mention name, right? But you know, Malaysia south is which country, north is which country.
Yes.
It's definitely much cheaper. And I think Bangladesh also have, but they have only 2 centers, and ours is much cheaper than your country.
Yes, and Malaysia is a beautiful country. We have so many cultural similarities,
Yes,
and
yes,
it's
yes.
very homely feeling there. So yes.
Because I understand that initially not many people in Bangladesh know about Malaysia. So I hope with this introduction, with this attraction, I hope more people will come, not only for cancer management or
Yes.
sickness purposes, come for holiday.
Yes.
Yes.
Yes, so many places to see.
Yes.
That's for another episode. Sanmun said, a very informative show. Thank you, doctor.
You're most welcome.
Firoz Sheikh said, Mr. Ali, do you see any patients in Dhaka?
No, I don't see patients, but they will see the doctors, the oncologists and so on. But if they want to come and see me, I explain to them why they require the PET CT. Because sometimes when the doctor asks them to do the PET CT, they don't fully understand why they require the scan. Because it is very costly. I think it's my moral duty to explain to them in more detail why it is needed.
Okay, and from my side, I wanted to know how will they contact your institution?
Oh yes, I think our institution we will leave a lot of cards, and what I think what my manager or your representative here,
GDSS.
will definitely channel
Okay.
them to whoever they want to see.
Okay, okay. Nusrat Jahan wrote in Bengali. I will read the comment in Bengali and then translate it to the doctor. She said, আমি যতটুকু শুনেছি মালয়েশিয়ান চিকিৎসা খুবই ভালো এশিয়ান দেশগুলোর মধ্যে. She said she heard Malaysian treatments are very, very, very good comparing to all the Asian countries.
Oh, I would say I can tell for Malaysia because all doctors in Malaysia, when they become specialists, they have to be registered with the Malaysian Specialist Registry. And to be registered under this registry, you must show proof that you are well trained. Doesn't matter whether you train in England or Malaysia, but it has to be certified. That's number one. And every year, those specialists, for them to continue to become a specialist, they must undergo further upgrading and so on. They must get certain number of points to get the renewal of the certificate. So definitely the quality of our specialists is at par with other developed countries.
Okay, okay. Rafiq Lal said, what is the special difference in cancer treatment from Malaysia to the other country in Asia? But I think doctor answered that already. Muntasirul Islam asked, he has joined us after a very long time. Nafisa Parvez, Mr. Ali, PET CT scan is badly needed for cancer patient, isn't it? Or do we use to find other diseases as well?
Oh yes, 90. I would say easily 96% of requests for PET CT scan is for cancer management. But there are other cases where we do PET CT scan. For example, for infection where the doctor cannot find the source of infection, and then they will come to me. It's a one-to-one request to do the scan for to look at the area of infection. The other thing that I didn't mention in detail is, when patient go for radiotherapy, in the old days, they do the radiotherapy to the area of interest, but the field of radiotherapy is very, very wide. But I told you that PET CT scan will tell you where the active area is. So they can actually narrow the field of radiotherapy for the active area. So in that process, they will destroy less normal cell as compared to previously.
Okay. Doctor, I think when it's a matter of cancer, we can call Malaysia as cost effective, but what we mainly want is the treatment to be efficient, to be effective, and that the procedure is safe. And by the conversation I had with you, I learned so much from you about cancer and the treatment in Malaysia. Thank you for your time.
Yes, I'm glad that you find this very appreciative, and that whatever I have impart is of value to you and the listener. But to make sure that it is you know it very well and you appreciate a lot more, come and see us in Malaysia.
Thank you, Doctor. Dear listeners and the audience who are seeing us, listening to us, I hope you learned about cancer. And if you go to Malaysia, or if you have any kind of physical difficulties that you want to get solved by Dr. Ali and by Be Healthy Doctors, of course, you have to go to Malaysia. And when you go there, you know you're in safe hands. And that's the motive of this show. Whenever you feel like getting Malaysian treatments, you know where to go and communicate through GG Assist. We will be back within a few minutes with another session of Be Healthy, brought to you by Malaysia Healthcare Travel Council in Bangladesh in association with GD Assist. Till then, take care.
Right. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Walaikum assalam.
Be healthy. Be healthy.
Brought to you by Malaysia Healthcare Travel Council in Bangladesh in association with GD Assist.